Berdikhojayev and my assistant Rawan Maratlov. We are from Almaty, Kazakhstan country. It's a beautiful country in the middle of Eurasia. And this is a national hospital of the Medical Center of Presidential Affairs of the Republic of Kazakhstan. There are two presidential hospitals, one in Astana, Astana Presidential Center, and this is the oldest one in Almaty. This year, 95 years since the opening the hospital. And we did the first case in the morning, and this is the second patient. The patient is gentleman, and this gentleman is 59 years old. He had a ischemic stroke in last December, and also the patient had a problem in peripheral arteries. He was operated on the right side. It was a graft placement. It was a aortofemoral shunting operation done, and on the left side also balloon angioplasty was done, and now we just starting the catheterization. I asked Rawan to wait for me, and as sometimes it's possible to catheterize and sometimes it's not. Sometimes it's a collateral filling, and the needle is pulsating, but not all the time. It should be the lumen. Yes, the procedure under local anesthesia. First of all, we should do diagnostic angiography. And patient has a chronic occlusion on one side and the possible stenosis on the different side. Okay. I'm feeling the pulsation, and it was angioplasty quite soon. That's why we are trying first of all to go through the femoral artery. We are planning to do angiography first, and then after angiography, we can decide about the possible treatment option. It would be endovascular treatment, or we need to do any kind of microsurgery with bypass. Yes. Укол болады, қорықпаңыз. Yes, the first case was a little bit stressful, and unfortunately we started under general anesthesia. That's why less less stress for the patient, and more comfortable condition. It was a big aneurysm. That's why we asked our anesthesiology team to start from GA, and it's not all the time possible to get general anesthesia, but on weekends we ask our administration to organize the anesthesiology team. As on working days, it's usually problem. This is a quite small hospital, only 100 surgical beds with all kind of profiles. Just a second, I need to. Yes, when you work from the left side, it's all the time problem. Okay, now I'm on the artery, inside the artery. Okay, let's check the iliac artery. And in such Leriche patients, the guiding and the guide wire should be followed from the beginning. And we need to check the position of the catheter. Okay, just a second. Okay. Control. Yes, the wire is inside the aorta. Yes. Thanks to Bachat, she put the Bakarasura. It's very helpful when the patient under anesthesia local. It might be a problem with navigation of the. It's a problem, huh? Тогда интразисурма? Я шестерка. Ну, кремижетр. Ана билеуден шығатында болады, қатылауға. Бере салыңыз. Қазір шестерка. Просто несін бере салшы. I will try to go with the sheath first. It's not go. It's look like there is atherosclerosis. Huh? Okay, now I need the needle. The needle first. Я восьмерку беру, Саш, восьмерку. Жесткий. Yes, it's a problem with the atherosclerosis, I think. Pedal бери, Саш, мама? Pedal. Yes, I need something quite stiffer. Yes, it's a problem with. Тоже ол жетпейді. Ана штативті жылышта салыңыз. Все, пока. Yes, it's patient with atherosclerosis. And it's all the time like this, huh? Oh, there is a stent. Yes, it's a stent. Yes, the problem, our colleagues is not informed that there is a stent. That's why it's a problem to go. If I knew about it, I don't see the level of the stent. Выпискасында жазылмаған ба?
Выпискасында тек баллон ангиопластикасы.
Yes, in the medical record it's only the balloon angioplasty.
Справа или сtent?
In both sides there is a stent, yeah? In both sides, okay. It might be our mistake. We should look for the stents first. It's never possible to trust to the colleagues, but it's look like in for distal part. Okay. Let's try to go with the 8 French. But the wire is quite soft. I'm not sure it will go. Huh? Проводник тартыш. Проводник тартыр. Yes, this should go. Yes. Now we are inside. Все. Карды. Yes, we're inside. Yes, it's quite distal from the disease point. Okay, just a second. We need to go with this. Abscess. Салфетка отмаса. Салфетка версаш, қолын тұтып Yes, we shouldn't trust any record. It was not in the protocol. Okay. Так, let's flush it. Yes, it's also possible to go from the right side. It should be no problem. Huh? Okay. Let's do it like this. It's okay, it's okay. Гидрофильный бар ма? О, блин. Yes, the old protocol was not correct information, and also patient has a replaced joint. Okay. The joint was replaced on the right side, the hip joint. Yes, it's okay. The artery is okay. Let's go distal and check the aortic bifurcation. Unfortunately, we started like this. Maybe. Okay, let's go in a correct way. Let's take a Neuromax. Let's take Neuromax here. Okay. It's better to go in a correct way. No, пожалуйста. Так, кім бар анда қыздар, балдар? Okay, now we know that the artery is patent. Yes, thanks to vascular colleagues. They didn't misinformation. Okay. We took burn catheter. That's a neuron select burn. Let's take Neuromax, and we can use it like a cheese, or we can use it like a
Drop again.
grading system. The length of the burn catheter is enough. Işte проводим салыр.
Қоңыр.
Любой салыр. Okay. We need to take this out from the table. Right. Let's start. Wire is arriving. Yes, wire is in place. I will check the right side also. Just a second. Hold it lift up, and then I will take out the wire. Пока қоя тұр, қазір қайтадан қолданамын. It's nice. I have no explanation where the stent is located on the other side. This looks like internal iliac artery. Oh, it's okay. I think they shunted the healthy artery is kept in place, and they put the graft. It's a shunt. Yes, the diameter of the femoral artery is bigger, yeah?
Yeah.
Yes, that's why there is a graft, I think. Okay. It was correct to go from this side. Okay. Я біздің науқасымыз декабрьде ғой, не? Айту қиындау, өйткені әр науқастың өзінің ерекшелігі бар. Бұл науқаста бірінші ерекшелік біз ауру тарихы бойынша білеміз, оң жақтағы сан артериясы мен аортаның арасында аорта феморальный шунтирование деген операция жасалған. Ол жерде жасанды артерия тұр. Біз жаңа ангиография жасаған кезде жаңа графтың сыртында стенттерді көрдік, бірақ ол қосымша тамыр тіккен кезде өзінің артериясы жанында қалып қойғанда, ал жасанды артерия соның жанында жатыр. Оң жақта солай жағдай, сол жақта екі жерде ішкі артерия iliac superficial деген бар, сонда мықын артериясы ғой. Мықын артериясында екі жерде стенд тұр, және ол аортаның төменгі жағында бітеді. Қазір біз аортаға шықтық. Біздің мақсатымыз аортаға барып, аорта доғасынан шығатын тамыр бар. Соны тексеріп шығамыз. Содан кейін қаншалықты бұл операция қиын екенін сол кезде айта аламын. Бірақ әр науқастың маңдайына жазған нәрсесі бар. Сол маңдайына жазған нәрсесі операцияны қиындатып жіберуі мүмкін. Көрейік қазір. Біліңіздер, арттарыңызды. Труба жылжиды. Бірақ біздің ойлағанымыздай жақсырақ, өйткені біз артерияға түсе алдық. Біздің қорқынышымыз болған мынау мықын артериясы егер бітеліп қалса, онда біз қолдан кіру керек едік. Ол артерия толығымен өтіп тұр. Біздің коллегаларымызға көп рахмет. Жолды ашып берді. Енді біз сол артерия арқылы қазір миға қарай өтеміз. Гидрофильный проводник бар ма? Так, енді операцияны қалай жасаймыз? The challenge number 2. We finished all hydrophilic 35 wires. And now we should work with the regular J-shaped diagnostic wire. It's a challenge number 1. I think there is a stenosis in subclavian. It's nearly occlusion, and it's a challenge number 1. Okay, let's see distal territory. Need to look for more proximal part. It looks like there is some arteries. But it's not clear, huh? It's not clear. We need to do more selective. Zion var mı? Bak. Beri saçtı. Yes. Okay, we asked for 14 coronary wire, which is Xeon blue. It has a more stable profile in distal part. Only distal 3 cm is flexible. Okay, let's check how it will work. As we usually do it with the Fubuki, but with this system is also possible. Okay, let's do it from the. Let's see. Подожди. Okay, we can leave it inside with no problem. It's just a 14 wire. Yeah? Okay. Let's check intracranial portion. Yes, first of all, we did a common carotid view, and it was no problem in common carotid territory. That's why we did a selective catheterization of the ICA, and you see there is a ACOM and there is a PCOM. PCOM is patent, and some part of the P1 segment is also filled. It's look like distal basilar also filled. Slight stenosis, but it's not significant. Now we can go back. I will do magnification. It's quite hard to see the anatomy. Okay, now we are in the left ICA territory. Thanks to neuron select, it's possible to do catheterization without 35 OR. Yes, it's quite soft diagnostic. I will do less zoom. Okay, we need to do the bifurcation. And it looks like there is a occlusion or subocclusion on this side. Yes, it looks like subocclusion. There is a ICA and there is a collaterals. Okay. I think we can reopen this artery with no problem. But first of all, we need to check the left side. First of all, we need to check left side. Something should come from this point. The problem number 2, we have no protection device. There is a first segment stenosis, but it's not critical. I think we can leave it like this with no problem. I hope you agree with me, Rowan. Yes, okay. I will check what kind of stents we have on the shelf. Так, бахът. Боковой снимта, левый сонный, да? Кавернозный диаметром чесаш. Так. Нас стентер шығарасаңшы, бәрін. Сороковкаларды 30. Бәрін шығарасаңшы. Okay, let's check the ICA first. This part is 1.6, but I think we can leave it like this. Maybe next time. It's also possible to go from the left hand and do angioplasty. But for me, there is a problem in right hand. In this territory, there is a stenosis or occlusion. It looks like stenosis. It's possible to do angioplasty in this place. We will see later. And we can open this artery. This chronic occlusion could be opened. It looks like there is a flow here, and I think just need to angioplasty this segment. Let's measure the distal. Да? Так, бақыт, екі жарымдық баллон бар ма? Интервенторын сұрайсаңшы. Okay, let's do measurement of this. So it's not 5. Okay. Let's go to the left side. Thanks to Penumbra company, this maneuver is possible. Бар еді? Бақыт. 2,5 бар ма? 2,5 баллон бар ма? Okay. We're asking for 2.5 millimeter balloons from our cardiology colleagues because of the tender and everything. It's not available in our catalog. Here's the angio. Smart mask koyasır. Raum araç. Smart mask. Aga, bir indiflator açıp verirsiniz. Bak. Indiflator açıp verirsiniz. Smart mask. Okay, smart mask is selected. Yes, also we can use this catheter. Гепарин бересіз, шамал. Уақыт шамал гепарин бересіз.
Гепарин бересіз ба?
Гепарин бересіз.
Шын жетені қоба?
Жетіп қалады. Okay.
И обезводите детство бахтать.
Okay, we are in the cavernous segment. Okay. Hey, boy. Let's check the circulation. Yes, I think it's possible to open. Neuromaxer. Okay, I will try to leave my neuron select in place. We don't need it. Okay, no problem. It went out. Бақыт. Бақыт. Нейроспид бар. 4-8 бересіңізші. Хорошо, 4-8. Қазір 1 секунд. Бақыт. Тоғыз 7-40 деген бір стенд ашып бересіңізші? Экзакт 9-7-40. Ашамыз. Екіншісінде ашсаңыз. И бір чекай блок ашып бересіңізші? Я. Потом бақыт не столда субмарин бар, 5 перкуссион ашып бересіңіз. Так, чекай блок ашып бересіңіз. Это капут. Я шеюсь. Okay, Xeon is fully damaged. Ne yapıyorsun? Arkasında olsun. Yes, the problem with the ICA black, there is a lot of friction with this system. 14 проводник сразу слышишь? Любой 14 проводник. Yes, it's a lot of friction. Let's see the result. Yes. Now we'll go a bit distal. Second set. Стерлингтен дейсің, қазір стерлингті үліп жүресің.
Свет жалко, вентилятор.
Давление просто. Электронный ростер.
Мощный, мощный.
Дорогой удовольствие.
Бағасы бірдей. Возможно, механический табло жасау қымбат болуы мүмкін. Электроника кезінде сондай болуы мүмкін. Бір жаман жері бұл одноразовый, да? It's a lot of friction, eh? I couldn't work with this. It's a lot of friction. Chikai Black is not working. Любой пилот по порталыма не бар, берсінші? Гая берсінші, Гая. Yes, for this business it's better to have something peripheral. Так, давай, стерлингті берсің. Yes, let's do some angioplasty in proximal stenosis. Maybe it will be helpful. Yes, I became older and older, and it's quite a problem to navigate the device without glasses. Sometimes with glasses, sometimes without. Пациенттің тамыры бітеліп қалған. Тамырға кірдік. Бірақ инструменттің ерекшелігі, кейбір инструменттер қазір полкада жоқ, поэтому ситуациядан шығып жатырмыз. Миға баратын оң жақ омыртқа артериясы бітеліп қалған, және сол жақта ұйқы артериясы бітеліп қалған. Қазір біз сол жақтағы бітеліп қалған ұйқы артериясын ашып жатырмыз. Құдай қаласа бір бітіруге тырысамыз. Сәлден кейін. Просто ол кісі қазір қимылдап кетеді. Аша береміз. Не видно, выпендрено. Ой. Давай. Дефлятор медицина. Гепарин істеді ма бір? Үшінің. Все хорошо. Пульс алып не жүріп. Атропин бір кубик істей салыңыздаршы. Все, үрлей бір. Төртеу бересің. Төрт. Назад. Все, давай, төрт. Назад. Еще раз төрт. Төрт. It's a submarine balloon 5x20. Алты бересің. Все, стоп. Назад. The pulse is not so reflecting. Так, да, төрт. Все, назад. Төрт. Назад. Вперед. Назад. There's a lot of friction with the ICA black. The balloon will live here. Now we need the Gaia wire. Gaia worm. Yes, Gaia is a coronary wire from Asahi, specially designed for chronic occlusions. But I think in distal anatomy we will need something like a microcatheter to control. Стоп, чуть-чуть вперед. Все. Окей. Все, стоп. Ана системада су тосылып қалды. Тасылып қалды. Я осы басқасын бер. It's finished. Yes, it's specific of the healthcare system. Yes, there is a tenders. You could not buy the material you want. You should work with the adapted situation. Yes, it's better. It's a governmental healthcare system, but it creates additional risk. It's also possible to say it's not possible to treat, and then you can do only limited things. Қазір біз екінші стендті ашып жатырмыз. Бір стенд ашып тастадық, қазір екіншісі ашылады. Екінші стенд ашылды. Okay, let's try to go to open the distal part. A little bit zoom in. Gaia is quite stiffer wire. Yes. Smart mask very so. I think the Gaia is long one. No, it's a short. We'll take a narrow speed. И системамен Y connector жалайсың. Бір Y connector аласың. Yes, narrow speed is 4/8, but in this anatomy we need something less. Yes. Okay. Let's take Gaia. The Gaia, they have a line. Gaia first, Gaia second, and Gaia third, I think. This one of the Gaias. And because of the symptoms and previous stroke, we decided to stent this chronic occlusion, and at the end we have a balloon, and I hope we can go and do angioplasty for the subclavian, the first segment of subclavian. Так, смарт маску особенно? Okay. Now we have a smart mask. Okay. It looks like we are in the lumen. Yeah?
А вот видишь это?
Oops, это. Ангиография же сажу. Ангиография же сажу. Okay. We are in the MC territory. Yes, it's MC. Now we will connect this. Okay, let's give me the Gaia Universal. Какой-то игрок. Джо, какой-то здесь, Саша. I will pull a little bit back because of the diameter of the balloon. So it like this. Okay. Inflate the lower part. It's very gently hand injection. Gently. Yes. It could be a little bit painful because it's a petrosal segment and it's very sensitive. Yes, at this segment ICA is more than 4 millimeter, that's why we can inflate till 4. Okay. Now we can check. It's better to take it out to prevent the mistake. Yes, now R3 is patent. Huh? And from this point we have two options. Option number one, we need one more stent in at this point till the petrosal, and then we need one stent in a cavernous segment. At the distal part of cavernous we need one stent, and at petrosal we need one more stent. Okay. Let's try to leave the Gaia. Ovaj konektor ustaviš. There is a technique I learned from René. And keep inflating, and now as balloon is out, we are inside the system. Okay. Okay. We need to remeasure the cavernous segment. Мақсат, сол жерде өлшеп жүре салшы. Дистальный жағын и мына сегментті. Длину сегмента померь, пожалуйста. Бахат. Не беш? Тағы бір экзакт беш? Сороковка. 8-6-40. Бере салыңыз. Жетеді. Thanks to Gaia, I think we could open the cavernous segment, and it's far more better wired. It's a coronary system, and for stenosis I prefer to use all coronary devices. It's much more reliable than the nerve. Nerve is quite soft. That's why I prefer to use coronary system. I think it's the end of petrosal. It's the exact stent from a good company. Because of sign of small dissection in peripheral part, we decided to place one more stent. Yes. Қанша шықты анау? 2-де 9, 24 шықты, да? 2-де 7, қазір тұрдыр? 1 секунд. I think we can remeasure. This point is important, it's nearly 2.9, and this point it's nearly 3.3. We need to stent this segment. That's 17. Бахат. Бахат, бахат. Так. Кастротыш. Yes, if we will place flow diverter stent, it will be very expensive treatment, and the healthcare system will pay very limited amount of money. Okay, let's try to place the coronary stent. На наш пересадку, Курик. Oh, it's very nice. Наш пересадку, Курик. После наш пересадку. Что он здесь? Нан өте аккуратно ашамыз. Где-то 4-ке дейін үрлесең, жетіп жатыр. Yes, we have a Ultimaster Tansei stent. It's a Japanese stent we're using quite often in our department, and nowadays it's Nagomi, but Tansei is also available. For this kind of anatomy, I think it's okay if we will use Tansei. Usually the diameter is a little bit not correct because of the decreased flow. It looked like less. Так, алдындағы ангиографияны смарт маска қойсар. Ага, смарт маска. Okay. Yes, the beauty of this anatomy, we can place coronary stent. It's specific of this anatomy. I think this part is okay. We don't need to go distally, and we will try to inflate less. 4 атмосфер. Вперед. Все, назад. Назад. Кастротер. Медленно 4-ке дейін үрле. I ask Rowan to inflate till 4 atmospheres, 3/18 stent. Okay. Слотер. Без пересол. We gave 5, and the problem is the stent is opening partially in some part because of the stenotic segment. Alt-versal. Now we give 6. Все, stop. Назад. Назад. As the distal part is opened, the proximal is opened. Only one of the proximal part is not opened. I think we can give nominal pressure. Yes, distal looks fit. Okay. Медленно жить версаж. Кастрот. 1 секунд. 1 секунд. 1 секунд. От енді жет вер. Жет вер. To prevent the rupture in distal part, usually it's helpful to bring the balloon proximally. Six. Toes. This part is tandem stenosis. I think that's why this artery was occluded. One barrier. Now it starts opening. Stop trigger. Sometimes it's helpful. Назад. Yes, it's no need for ideal image. We can leave it like this, and it's possible to do angioplasty later. Just a second, there is also the technique like this. One better. We'll give 10. Okay. Now we'll give 10 atmospheres. Yes, in distal part, balloon is inflating better than in middle part. One bar, yeah? It's 10 atmospheres and one bar there, sir. Now we'll give 11. Все, назад. Okay, I think it's enough. We inflated till that's 3.07 millimeter. I think the diameter of the artery is a little bit bigger, but it's no need to overinflate. There is no need for overinflation.
Buffer contrast.
Second. Now we will do angiography, and then we can decide should we do anything extra. As the MC territory is present, no sign of emboli. Stop. Назад. As artery is opened, ecom is patent. As MC territory is clear. Вперед. Okay. It looks like everything is okay. Now we'll keep it in the common carotid contrast. As the brain looks normal, it's okay. Давление қанша болды екен? Очень саласыздар ма? As thanks to carotid stenting in proximal part, the blood pressure is decreased, and it's a key point. And now we can move for the right subclavian. Давление 100 айналасында болған дұрыс. Okay. To place the Gaia. The balloon, then we can push. Okay, let's do angiography. Water is finished. Okay. It was very slow inflation, injection, infusion, but it's finished. Okay. Пожалуйста. Қазір Құдай қаласа жақындап қалдық. Our journalist is waiting for the finish of the treatment. Smart mask. Назад. Осылай. Smart mask. Yes, there is a stenosis in the subclavian. Okay, doesn't go there. Yes, usually it's better to go with the Judkins right, this system. It's overcurved. Okay, let's try to take Chikai. Maybe Chikai will work. Then we can ship it. It looks like subocclusion of the subclavian. That's why the pulse on the right side is very bad. Ancha, darling. Yes, seriously. Torker versus. Okay, I think we need to go with different approach. Quieter. Let's take diagnostic one. Ишни гаян берсеш. Гая. Y connector Mynzhylky. Крыс пошел Y connector. Okay. Yeah. Сол жақтағы ұйқы артериясын толық ашып тастадық. Ақсақалмен бір ауыз сөйлессеңіздер болады, бірақ атын сұрамайсыздар ғой. Сұрай беріңіздер, бізге кедергі жасамайды. Ақсақал. Назад. Ne yapıyorsun? Проводник назад. It's a vertebral artery. This is okay. Пятерка нарисовал. Пятерка. Оң жағындағы бұған артериясы да өте қатты тарылған. Сондықтан біз қазір сол жерге барып, баллонмен үрлеп кетеміз. Ол жерге стенд қоймаймыз. Так, стерлинг 14-ке дейін қойды. 6 бересің. Үрлей бер 6. Yes, we passed with the neuron select. Көбірек берер. Вообще көрмейді. Қайтадан. Сдавать етіп қайтадан үрле. Okay, just a second. Үрлеп стоп тұра бер. Yes, balloon is in place. Все, сдавай. Давай, тағы да 14 бересің. 14. I'm asking Rowan to give 14 atmospheres. It will be 5.5 millimeter. It's a Sterling 5 millimeter. Все, хорошо. Yes, this gentleman is completely atherosclerotic. Both iliac arteries was diseased and nearly occluded, and on the left side vertebral artery is stenotic. On the right side subclavian is suboccluded. Right ICA was occluded, and I think there's also coronary problems. Huh? Yes, it's coronary problems. Все назад. Yes, let's do the angio. This was far more better. And so. Smart mask. We can give a little bit more. So do. I'm asking Rowan to give 15 atmospheres. The artery diameter is quite not so big. Yes, it's a problem with the roadmap, huh? On this? 18 verirsin. Все, сатырар. We give 17 atmospheres. Сөйлестіңіздер ма? Қазір болайын деп қалдық. It will take 5 minutes and then we can finish. Қалайсыз аға? Бәрі ойдағыдай. Сол жақтағы бітеліп тұрған тамырды аштық. Оң жақтағы қолға бара жатқан артерияңыз бітелейін деп жатыр екен. Оны да қазір баллонмен үрлеп жатырмыз. Қолыңыздың ұшын былайынан қимылдатып көріңізші. Так, оң аяғыңыздың табанын қимылдатып көріңіз. Все, болды. Қолыңыз қимылдатып көріңіз. Қолыңызға шамалы қан барды ма жаңа? Қазір баллонды сдавать ете бер. Қазір сезіп көріңізші, қолыңыз жылған сияқты сезім болды ма? Жарайды қазір сәлден кейін. Все, қазір Құдай қаласа 1-2 снимктан кейін бітіреміз. Жарайды? Yes, we opened the left ICA and we revascularized the right subclavian. It was a nearly occlusion, and now we will do control angio, and then we can do control CT and finish the case. I hope we can finish the case. I will ask Rowan after this control DSA to check the city, and then we can finish the game. Finish the case, not the game. Maybe in the future it will need a short stand, but not today. It's quite risky. Okay, you can see the buzzer system. It's good. Now I will take out the guiding. Okay, let's wait for control city. Şu бітова там скажешь. Томография будет? Сыртқа шыға берсек болады қазір. Томография жасайсың.
Еще не бірден томография түсірді.
Иә, осы жерден томография түсіреміз. Мына жерде Қазақстанның жалауын қойып қоямыз қазір. Мына жақсы болады. Мақсат көш. Полтора часа, да? Полтора часа. Где-то полтора часа.
Час 22.
Час 20. Ну, полтора. Потому что по пояснице чувствуется, что полтора часа.
Тетен уже что, лохот чувствует, да?
Да. Коленки чувствуют. This is a post-stroke territory on the left side, and yes, it's post-stroke territory. And brain is clear. We'll keep him in the ICU, and the blood pressure now 110/60. Okay. Just a second. The Sunday is now going to the end. I wish you a nice weekend, and now we can finish the case. Hope to see you next Sunday. On Friday we are planning cases in Tashkent, and on Saturday in Dushanbe in Tajikistan, and Sunday in Almaty. I hope so. Thank you for watching. See you. Bye bye.